Hello and welcome to HealthAfrik on AAU TV. AAU TV is the voice of higher education in Africa. Today we are continuing our discussion with All Smiles Dental Clinic, and we are discussing dental surgery. I know at the mention of dental surgery, or even if your dentist tells you to come for surgery, you will be scared, you'll be worried, you are thinking it's too expensive, you are thinking, oh, can I go back to my usual life? Can I use my teeth to do what I use it to do? I know all these questions are bothering you, but then dental surgery is not as bad as it is portrayed. That is why today the dentist here is going to tell us more about it. It's actually an outpatient surgery, so even after the surgery you just need a few days to recover and you can go back to your normal life. It's going to be an interesting conversation on dental surgery. Please stay with me. My name is Bridget Amadente. I'll be back and I'll introduce my guest for today. You're welcome back from the break. This is still HealthAfrik on AAU TV, still on our dentistry season. And today I have the pleasure of being with Dr. Nathaniel Isel. He is a dentist here at All Smiles Dental Clinic. Doctor, you're welcome.
Thank you so much.
It's a pleasure to have you here again today.
Thank you. Thank you.
Okay. So it's been 2 weeks and this is our third week and final week. Yeah. Today we are discussing dental surgery. I want to know what dental surgery is and then the types there are. Okay.
So basically, dental surgery or surgery, let me just, in a broad sense, surgery involves treatment or repair of any body tissue in dentistry. So to extrapolate it into dentistry, treating or repairing any form of damaged tissue in the mouth, the teeth, the jaws. The key point between surgery and medicine is that in surgery there's a bit of cutting. So we invade the body by cutting into it. That's what surgery is. So anything that involves a bit of cutting into the body is termed as a surgery. Okay. So in dentistry we have several types. We have several. The most common one is the extractions. That's the most common one.
That's why people are scared.
Exactly, yeah. So that's the most common one, but there are several types. We have implants, we have actual maxillofacial surgery. That one, it doesn't really deal with the teeth per se, but problems with the jaw, the face, the people who come with fractured jaws, people who have tumors of the jaws. So that's also a bit of maxillofacial surgery, which is into dentistry. So there are several types. We have root canals, we have the cosmetic dentistry bit. So there are several types. All of them involve a bit of cutting and invading into the body tissues, the dental tissues.
But then there are a lot of myths with regards to dental surgery. People say when you do a dental surgery, you can't chew again. You can't bite meat. Like the way you want to enjoy your willy and bite it with your front teeth or your inside, you can't do all those things. How true are all these things?
Okay, so to an extent, it's a bit true to an extent, but it's not all true. The one that I've heard, which is personally I've heard, was that if you do any form of extraction, your head will swell up and you get a lot of. Okay, so I've actually heard someone tell me that he doesn't want to take out the tooth. Meanwhile, there was a swelling already, so we wanted to take it out. The tooth was infected. He said that when we take it out, his head is going to get swollen and stuff like. All those things are not true. The other one that I also heard, another myth that I heard, was that once we take out one tooth, we have to eventually take out all the so I've also so they are not true. Basically, they are not true. They are just things that people say to sort of excuses to give themselves not to attend the clinic. Basically, that's it. So those are the two that I've heard personally.
But if you take out one, how is it going to affect all the others and it will just fall off?
So they prefer doing these mouthwashes, these herbal concoctions and stuff like that.
Okay. So the whole idea about it being painful or you can't go back to your old life, it's quite a myth, right? Because I doubt you can. I know you can go back to your old life.
Yes, actually.
has it got to do with the way dentistry was done in the past and how it's done now, or what has it got to do with?
Exactly. So in the old times, there wasn't a lot of anesthesia. That's the numbing of the place. So people still have that notion that it's expensive, it's painful. Sorry, it's very painful because their grandparents told them that stuff like that. But these days, we do everything under anesthesia. You don't even feel the sensitivity, yet alone the pain. So now we have a very good anesthesia which goes with any form of surgery, any form of procedure that we have to do. So it's really a myth, basically. The problem is that sometimes some anesthesia might not work. Those are very rare conditions. Anesthesia might not work, and then after the anesthesia wears off, there's a bit of pain or mild pain. So, but after we do the procedure, we give them antibiotics, we give them pain meds to sort of reduce that uncomfortable feeling till the place heals completely. So right now we do everything under anesthesia. We numb the whole place, and we do everything as painless as possible.
Okay. So let's move on to the various surgeries that there are. You talked about root canal. Let's take it one by one. I have a long list here. You start with root canal.
Okay, so the root canal therapy is a procedure. You know, if you've been following the series, I mentioned that the tooth is in layers. We have the enamel, the dentin, and the pulp. So once there's an infection which has traversed these layers into the pulp, we need to sort of treat the pulp. And the treatment of the pulp is what we call root canal, because the pulp is in a canal. And then it's in the root of the tooth. So we call it root canal therapy. So we are treating that canal. Basically, that's it. So we go inside, take out the infected pulp, clean inside, put some medicaments there. Oh, it's not painful. It's not painful. Not painful. And so we make a hole in the tooth so that we get to the pulp. Usually when that happens, it means that the pulp is already exposed, so it's not any. So we just go through, clean inside, take out the infected pulp, put some medicaments in there, seal the place, and then build the tooth up again. That's basically a root canal. So that one is just on a single tooth or multiple teeth if all of them are involved. So that one we are saving the tooth as to extraction of the tooth, basically.
But then the tooth is quite a small thing. So for you to talk about go in there, clean, put something in there, it's all, I'm just picturing it, and then I feel like this whatever thing you're going to put in there to clean must be a bit painful. But you say it's not painful.
No, it's not.
Really?
It's not at all. It's not at all. If I give you an injection right now to numb the place, you feel like the whole side it's numb. You don't feel anything till about 2 hours, 3 hours before it wears off. So the place becomes very heavy and very numb. You don't feel anything. Completely painless.
Dental implants.
So implants refer to their prostheses. You know, basically they replace the roots. So when someone loses a tooth, you know, the tooth, we have the crown which we can see, and then the root is embedded in the jaw. So once someone loses the tooth, we have what we call the implant, the dental implants that we push, they are metals that we push into the jaw to form a bit of roots for us, so that we can put a replacement on top of it. So that's basically an implant. So we push it into the jaw, and then we put the crown on top of it.
And then it fits.
Yeah.
It won't come off.
It won't come off at all.
Do you have to what do you call it?
Review.
Review.
Yes, you have to come for.
Yes,
you have to come for periodic review. No, because it's a foreign material that we've put in there, so we need to sort of be taking care of it, clean around that side, periodically. Yes.
So what happens if someone loses, let's say, all my front teeth or the upper part of the teeth, and then I lose it? How do you try to fix it there and make it stay that it won't fall?
Okay, so we have several options. We have the removable one, and then we have the fixed one. The fixed one, we've spoken a bit about it. That's the implants. And then we have ones that we call the bridges. So the bridge, it connects one side to the other. So we use the call it abutment or the support, the adjacent teeth as support. Then we put the replacement from that side to replace the gap that's there. So those are, we have the removable one, which is the dentures. They fit also perfectly. But as time goes on, we feel like people prefer the fixed one that they don't have to take out when they are going to bed. So most people are going into the bridges now, and then the implants also. So that's those are the treatment options.
Okay, but then I remember seeing in someone's mouth, I'm so sorry, but then I just saw the thing. It was as if there was a metallic something holding the upper part of the teeth. That is why I asked, because I was wondering what exactly is holding it. It was like a shiny metal that is holding the upper part of the teeth, but in this side of the mouth, like getting to the molars.
Okay.
Yeah. So I was wondering what it was.
Okay. So how did it look like? It could be a lot of things.
I don't know. You know, it was just a flash.
Okay.
So what I saw was a shiny substance that was kind of holding the teeth and looked like a hook, something that had been.
Okay. Okay. So that could be usually we call it support.
Okay.
For the patient might have been wearing a denture, but we are using the back teeth, the molars, as support. So the denture sort of hooks onto it to provide extra retention, so that the denture doesn't fall off. Exactly. So that could be it. I'm not so sure, but I think that's basically it.
Because it looked like a hook that was just like supporting the teeth. Okay. Wisdom tooth extraction.
Okay.
That one you can't tell me it's not painful. Because even when it's coming, the pain it comes with, and then you just want to take a leave of work and sleep.
Okay, so yeah, wisdom teeth extractions. Yes, they are much more intolerable. I don't want to use the word painful. Patients really don't tolerate it that well. So in other facilities in other countries, they try and do it under conscious sedation. So they sedate the patient. Some people also use the local anesthesia. What we do is in cases where the wisdom teeth needs to be extracted, it's sometimes due to inability of the wisdom tooth to fully erupt, especially the lower ones. So it's sort of embedded in the jawbone. So it's instead of it coming out straight, it's sort of turned in a weird way that's preventing it from coming out straight like the other teeth. Usually it's because it's the last tooth to sort of erupt into the mouth. So by the time it's ready to come out, there's no space for it. So it's sort of turned in a weird way trying to come out, but eventually it doesn't come out. So when that happens, the gum grows around it, and then some way, somehow, the upper wisdom teeth had already erupted. So when the patient bites, the patient is biting onto the gum tissue around that side. That's what causes the place to become inflamed. So when these conditions, called pericoronitis, when it goes on for a long time, the patients can't tolerate it, and then the only treatment option that they have is for us to take out the wisdom teeth. With the wisdom teeth, we numb the place. We don't do both at the same time usually. We do one side and then next time you come for the other one. So we numb the place and then we reduce a bit of the jawbone. So that to give us a bit of leeway to take out the tooth, because as I said, it's embedded in the jaw. So we can't just hold it and bring it. So we cut, we do a bit of minor surgery, we cut around it, reduce the jawbone and then take the tooth out. After that we close it up and then the place will heal completely in about a week or two. So that's wisdom, generally a summary about wisdom teeth extractions.
You mentioned that by the time it comes out, it's like it has no space. Is it because the jaw is small or it's already filled up? So why is it still coming? Yeah,
so basically there's this tooth and then jaw size discrepancy in dentistry. Someone might inherit a small jaw from their mom and then big teeth from their dad, or the other way around. So there's this discrepancy that's sort of brings these things about. Right now we don't really know what's happening, but people are turning up with smaller jaws.
Really?
Yeah, basically I think over the generations our diet has become soft, so the jaw is not really as big as it used to be. So basically the thing is right now,
some years to come the jaw will be like this.
Exactly. Right now it's a form of evolution sort of thing. We don't use the wisdom teeth for anything. So when something happens to the wisdom teeth, we don't try to save it or we just take it out, because we've realized that no one uses it for anything. No one uses it for chewing, no one uses it for anything. It's just there for decoration, in a way.
We are going on a break. When we come back, we are continuing with reconstructive surgery. I know you're wondering what it is, so stay tuned. I'll be back shortly. You're welcome back from the break. This is still HealthAfrik on AAU TV discussing dental surgery. We are moving on to reconstructive surgery. What is reconstructive surgery?
So just as the name suggests, we are trying to repair, reconstruct whatever has been lost. Okay. Usually, patients who undergo these kinds of surgeries are tumor patients. If there's a tumor of the jaw, we have to cut out the tumor part, and then after a while we replace it. Because if there's a tumor around here, we don't want it to go and then spread all around. So we sort of cut the jaw like that, with the diseased part, the cancerous part, and then we take it away. So we have to sort of bridge that gap left off by the surgery. So that's what we usually do. We can use titanium plates to reconstruct the jaw, or we can harvest a rib and then use it to
harvest a what?
A rib.
Jesus.
A rib. Yeah.
Really? And put it there.
Yeah.
So it's not like you can put some artificial jaw to bridge the gap.
So that's what we are doing. But we can't take a jaw from a living person and put it there. So we have to use your own or put in a metal. Yeah. So basically that's it.
No, wait, I'm confused. Harvesting a rib, like the ribs we have
rib,
here.
Yeah.
How? Because it looks like it's bigger or it's smaller. Like what goes into it? Because I'm confused.
Yes. So basically, we take one rib.
Okay.
And then we put it there like that.
Okay.
You see, the job, it doesn't have to be the same size as. We just need something to hold it, to bridge the gap, basically. So we sort of build it up a little, but we harvest it, basically. That's what we just need. It doesn't have to be the size of the actual jaw like that. It's just a thing like, So even with the metal chain, the titanium plates that I was talking about, it's not very big like that, because those things are heavy. So we just need something thin to hold it, and then basically that it works.
No, but if you take out a rib, will the person still be straight? I mean, the spine.
You know, there are hanging ribs. There are ribs that really don't perform any form of function. Yeah, so we harvest those ones, and it's not like we take out the whole rib. Sometimes we take out just the surface. Okay. It's not like we are taking out. We just cut a bit of it, have that covering, and then put it there. Basically, that's it. It's complicated. I'm trying to simplify it, but it's not. It's not. Simple like that, But we have the plates also. Usually, most of us, the ones that we do, we use the titanium plates to bridge the gap. Well, not really.
The dentist saying not really.
It depends. And then aside the tumor cases, patients who the Okada riders who sort of fall down and then they break their jaws, they also undergo a bit of reconstructive. So there's a whole section of dentistry which deals with, we call it maxillofacial surgery. So they are really not into the teeth per se, but the structure surrounding the teeth. So dentistry actually covers the lower thirds of the face. So this side is not for us, but from the bridge of the nose, up to the neck is a bit of dentistry. That's our side. So maxillofacial surgeons deal with those ones.
At the mention of maxillofacial, let's talk about that one, because if they are really concentrated on the jaw and then how the face looks, reconstructing it, what else goes into it?
So I've already mentioned the tumors.
Yeah, the tumors.
So they are the specialists who deals in the tumors, and then the fractures.
The fractures.
Yeah. So basically, that's what they do, and more. They can also do a bit of implants also, but they are more like a surgical people as compared to the general dentist. Yes. So basically, that's what they do. So the tumors, any salivary gland lesions of the tongue, the fractures of the bones, tumors of the bones, basically cleft lip, all those ones. They do those ones.
But I'm still trying to picture a lot of things in my head.
Yeah.
Looking at how you're going to fix your jaw, your small mouth, or they will cut it. Will they cut your mouth to create space to work on your jaw, or how do they ensure that your mouth is in a better space, or it's open enough for them to work on your jaw? Because I'm trying to, you know what I'm trying to
say? So we let me just say we cut and then we retract. Yeah, so we try and hide it as much as possible. So we go through the mouth and then peel off the mucosa, that's the gum, till we get to the bone, or the place of interest. And then we work on that side. After that, we suture everything back, the place we heal, as if nothing happened, basically. Yeah.
Okay. Yeah. Let's move to cosmetic surgery.
Okay. So cosmetic surgery is basically what most dentists do. The fillings, the crowns, the bridges, the whitening, the cleaning. Basically, that's it. Yeah, that's cosmetic. Anything to make your face nicer, to make your smile better. Yeah, so that's cosmetic.
Okay. So last week when we were here backstage, we were talking about bridging the gap. Dr. Emma talked about a particular thing that you can do to ensure that my diastema doesn't get any bigger. She mentioned the name I have forgotten. I want you to take us through that process and what goes on in there.
Okay, so I believe she mentioned the frenectomy.
Exactly.
So the idea is that we have we call it frenum.
Okay.
So there are these thin lines which we have two here, and then one down here, and then one at the top here. So usually it's a muscle or it's a tissue sort of. So as you talk, it sort of expands a bit, like it's mobile. Yeah. So it's mobile. So it's sort of, as you talk, it gradually opens up the gap if you have a midline diastema to that side. So what we do is we try and then cut it to prevent that connection between the teeth and then that side, the frenulum around that side. So we just cut it. That's the frenectomy. So that's what she was suggesting, that we cut it so that to prevent that sort of mobility, at least to stabilize it for now. Yeah. But another thing that might widen your gap if you have a small gap is your tongue. If you keep pushing your tongue through it, basically it sort of also widens it a little. Yeah. So basically that's it. So if you know someone who has had braces done, they put retainers to prevent relapse. So they wear retainers, or they put a metal bar behind the teeth to prevent it from relapsing. Yeah, exactly. So we sort of hold it in place. That's the same notion, the same idea behind the frenectomy, to sort of cut it and then stabilize it a little.
Okay. So wait, let me get this right. Prosthodontics, am I right?
Yeah, prosthodontics.
Exactly. I'll mention it again.
Okay, so prosthodontics was derived from the word prosthesis. A prosthesis is any replacement. So we already spoke about the crowns, the bridges. So that's the part of dentistry we deal, so the replacements. The implants are also a form of prosthesis. So they are under. We have a specialist who does all those things. Yeah, so basically that's prosthodontics. So any prosthesis, anything. Sometimes they even go as far as replacing the nose for a bent victim. Yeah, so it's extreme. The lips, the upper lip. Yeah, so all those things are the tooth itself. As I said, we have the fixed and then we have the removable. So all those things are under any form of replacement for any missing tissue, your tongue, something. It's a form of prosthesis, your nose. Your
so those who fill their upper lip, is it the same prosthesis?
The lip fillers.
Yeah, the lip fillers.
I don't know whether they are prosthesis. I really don't know. I don't think they are. I don't think they are prosthesis.
Okay, that's fine. So now that we know a bit about the surgery itself, I want you to tell us, if someone comes and then maybe you diagnose the person, you tell the person that this is what you have to do, and then maybe the person agrees to actually do it. What should a person look out for and do in preparation for the DD?
Okay, so let me just use a simple extraction as an example. So usually if the patient agrees to the extraction, the patient wants an extraction, we want to make sure that the patient has at least eaten that day or a few moments to that day, because the anesthesia we give sort of requires you to have a bit of sugar in your system before we do it. Sometimes it sort of depresses your sugar such that the patient might collapse. So we want to make sure that they've eaten first. We also want to make sure that they are calm. Some people are very afraid, especially of the needles that we use. So we try to at least calm them down, explain the procedure to them, reassure them that it's quite painless and nothing sinister is going to happen. So basically that's it. The main thing is that we want to make sure that they're in the right state of mind and then they've eaten, basically.
Okay. And then after the surgery, what should the person do?
Okay, so using the extraction as an example, we give them instructions. The main thing that we want them to do is that they bite on the gauze. Gauze, like a bit of cotton roll. They bite on it. That we give them here. They bite on it for at least 30 minutes to prevent bleeding from the site of the extraction. So that day too, they won't spit out. They won't sort of rinse the place for that day. Because we want the blood around the site to clot so that healing can start immediately. That's why we sort of try not to disturb the place. So they can eat, they can chew, but they don't chew on the affected side. No spitting for that day also. Basically, that's it. We have a whole list of things that they do. After 30 minutes, they take the gauze out and then they go about their normal duties. Basically.
And how many days will it take to fully recover?
Well,
or weeks, depending on how you yourself take care of yourself, right?
Well, yes, but usually after, if you do a simple extract, depending on how difficult it is or how compliant the patient was, you can go back to work that same day. We just need you to sort of be okay. Sometimes the people feel dazed a little, or they experience a bit of headache, so we let them rest for about 2 hours or so. But you can resume. It's not like you need to recover for 3 days or something. It's not like, it's not deep. Let me just say it's not deep.
We're wrapping up here. Your final words of advice to someone who has to go through some dental surgery, but then is afraid, scared, looking at the cost, looking at the way his or her life is going to change. You won't be able to chew with lead, those kind of things that people think. Please talk to them, and then we are done. Okay,
all right. So I just want to say that it's not worth it living with your pain or trying to bear whatever it is. You know, there's a fix for whatever you are going through. Dentists have been portrayed to be wicked people or people without feelings or something. But if you see me, do I look like someone? Exactly. People are really scared of us for basically no reason. So it's not scary at all. It's not scary at all. It's really not expensive. The thing is, for the example that I gave you about the cavities, as it keeps progressing deeper, it becomes much more expensive to treat. So once you see something small, always try and then come to the dentist. Okay, there's nothing to be afraid of, and you don't have to wait till there's pain before you come for treatment. You can just pass by every 6 months and for just a routine review, then we will just take a look. So all basically that's it.
Thank you so very much for gracing us with all the information we can think of about dentistry, and we know that there's much more that we still need to learn, and we'll be coming back. But unfortunately, this is our last for a dental series. We'll bring you another dental series. Definitely, because these people, all smiles, they're doing an amazing job. But today there's no practical, we can't do surgery on TV. Thank you so much for staying tuned. If you missed the conversation, you can watch again on Facebook, Association of African Universities, and then on YouTube, Association of African Universities. Thank you all, and keep watching AA